So third common group of diseases that we encounter in day-to-day life is the proctology. Proctology means piles, fissures, fistulas, perianal abscess, pilonidal sinuses. We have various different treatment modalities like laser, stapler and other open techniques. So nowadays laser is very common, but remember one thing, just using laser is just one gadget for the treatment of surgery. I mean, it's not like a magic wand. We move the laser around the patient and patient gets cured. It's never like that. Laser is one of the gadget, one of the energy source that we use to treat the piles. Along with that, one should have a proper surgical technique that cures the patients. So laser plus surgeon's proper modified advanced surgical technique that will give the total cure to the patient. One is laser. Second, we use for the grade 3, grade 4 and prolapse piles, stapler. We call it as a stapler hemorrhoidoplasty. Again, you can see this is a stapler. It has circular end wheel which goes into the rectum and which goes into the anal canal, and we fire the stapler. So it is also one of the important gadgets that we use for the surgeries. Apart from that, I would like to highlight one point. So it depends upon patient to patient in which patient which surgery is to be used. I always tell my patients that in some cases you may need mixed, that I will be using laser also and I will be using stapler also, or sometimes I tell my patients I will use laser also and small cut also. So you understand the main intention of using all these techniques and gadgets is total cure of the patient. So accordingly we use these gadgets to cure the patients. So what are the advantages of these advanced gadgets? For example, if you use laser, if you use stapler, so the pain after hemorrhoidal surgery is very less, minimum pain. Swelling after surgery is minimum, and in conventional technique there was much bleeding even after surgeries, many days after surgery, but this is not seen in the surgeries when we use advanced gadgets. Recurrence rate is low and it is cost effective also, and we keep patient for a night, or maybe patient can be discharged on the same day late evening. Patient can start his activity as early as possible. So it has very these procedures, advanced procedures have a certain advantages or the conventional techniques. But again, I would like to highlight one thing: we cannot use same technique in all patients. It is a patient selection. In which patient we can use laser, in some patient we can use stapler, in some patient we need to have some cut, because the intention is to cure the patient with minimum pain and maximum recovery and without any complications. Thank you.